If you have a Medicare Part D prescription drug plan, I've got news for you. News that if you're not careful, well, it could cost you an extra $600 a year in 2026. And more than 1 million seniors on Medicare Advantage, well, they're going to discover that their plans are being eliminated altogether. But don't panic. I'll explain what's changing, why it matters, and what you can do about it. And in the notes below, I'll give you a free step-by-step resource. It'll help you on your own be able to shop for Part D plans, Medicare Advantage plans, and read your annual notice of change this fall. So what's changing? First, there's a new $2,000 cap, max amount of pocket cap for prescription drug plans. That began in 2025. It's for medications that are on your prescription drug plan's formulary. In 2026, it's expected to adjust to $2,100. But that's real relief for those on high-cost drugs. But it shifts the burden to insurance plans, and that means higher premiums for everyone. Second, expensive drugs and more of them. Spending on GLP-1 drugs like Ozempic, well, it's exploded from $57 million in 2018 to an estimated $5.7 billion in 2022. That surge is reshaping costs, and when utilization spikes, premiums follow. And then third, policy changes. Government subsidies that once helped stabilize premiums, well, they're being scaled back. And as you can imagine, less subsidy means more liability on the health plans and higher costs for you. So that has a ripple effect. And CMS projects that the Part B premium for 2026 may jump as much as 11.6%. That would be up to around $206 a month. And that would be the steepest increase since 2022. Meanwhile, insurers are scaling back Medicare Advantage PPOs. United Healthcare is dropping 600,000 members, and Aetna is discontinuing plans in 34 states. The era of broad networks and free perks, well, that's ending. That's why this year is different. So every September, your plan sends out an annual notice of change, or an ANOC. Most people just toss it aside. This year, don't, because premiums, benefits, and drug formularies will all change. And once December 7th passes, you're going to be locked in for the rest of the year. So here's your 3-step game plan. Step 1, watch your mailbox in September. Read the annual notice of change. Step 2, shop your plan during the annual enrollment period from October 15th through December 7th. Compare your drugs at your pharmacies and for your total costs. Step 3, use the right tools. You can go to medicare.gov. It works very well. Or in the notes below, you can use the link and shop for Medicare Advantage and prescription drug plans on your own and find the plans that may work for you. A note for families. If your parents value the freedom of original Medicare plus a Medigap plan, remind them that switching back to a Medigap plan from a Medicare Advantage often requires medical underwriting. So don't let a rushed December decision close doors for you forever. This may be the most disruptive Medicare season in decades, but preparation is protection. Read the ANOC letter in September. Compare your plans in October. That way you can start January with confidence. And now you know the rest of the story.